Hola mi gente linda, esta es la doctora Ileana Ponce-González, la directora ejecutiva del Community Health Worker Coalition for Migrant and Refugee, y los invito a que me escuchen todos los lunes de 1:30 a las 2:30 desde los originales CHW Radio, la única emisora en español desde la ciudad de Edmond, Washington, las 24 horas del día, los 7 días de la semana. Hablaremos de todos esos temas importantes de salud que afectan nuestra comunidad, especialmente para todos ustedes los Community Health Workers. No se la pierdan, los esperamos. Gracias.
Los originales Community Health Worker Radio.
Hola, muy buenos días. Esta es la doctora Ileana Ponce y estamos en el programa Hablando con la doctora Ponce, hoy lunes 9 de agosto de 2021. Estoy muy feliz porque hoy tenemos a una persona que es una persona muy importante para la coalición, ya que es parte del board, el doctor Michael Parchman. También él es una persona que apoya mucho a la coalición y trabaja con la facultad de la Universidad de Washington y con Kaiser Permanent, el Instituto de Investigación McCall. Welcome, Dr. Parchman. How are you?
I am very good. Thank you for inviting me here. I'm happy to be here today.
Thank you. We are going to talking with Dr. Parchman. As I said before, Dr. Parchman, he is a investigator from McCall Center. That is the research institute for Kaiser Permanent in Washington. And Dr. Michael Parchman is also our board director chair. And we are very happy that he is here with us because he is very busy. He's an international recognized scholar, and he has been one of the principal investigators in many research, including diabetes, opioid overdoses, COVID-19, and many others in primary care. Welcome, Dr. Parchman. How are you?
Thank you, Dr. Ponce-Gonzalez. I am happy to be here. I am doing well today. Thank you. How about you?
Me too. We are happy and a little worried because, as you know, the last report we're receiving about the COVID-19 cases is that there are more than 5,000 new cases in the state, and this is very alarming. Principal, because we believe more than 70% of the people now is vaccinated, and this is why you are here today to talking about COVID-19 variants.
Yes.
But before we're talking about COVID-19 variants, I want you telling us why we need to do we need to care that this is increasing, why there are more variants? Before we start with those questions for Dr. Parchman, I invite everybody that is joining us to make the comment and ask questions with the experts. We have here a Kathleen Perez. Welcome. We have a Raquel Yapes. Aquí estoy con ustedes. Thank you, Raquel. And we have Carla Fernandez. Welcome to all of you. And they say to you, welcome. We wanted to see today, before we start, remember how the COVID-19, because what Dr. Parchman is going to talk has too much to do with this video that we find in YouTube. And this is a video that talking about how the COVID-19 produce COVID-19 pneumonia. Let's see together.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These
We are back here with Dr. Ponce, with Dr. Parchman, and we know now how coronavirus get pneumonia, no, doctor? But this is happening not only in the lung, it's happening in all the body. Or I am wrong?
Well, the coronavirus primarily infects the cells in the respiratory tract, but the body's immune system reaction does involve the entire body, which is why you get fever and headache and the other symptoms that accompany the COVID-19 infection.
Exactly. What do you think? Why we had many variants? Why we are at the spread of many variants now? Do you know?
Well, as we just saw in the video, the virus cannot exist or live outside a host. In this case, the human host. So the virus can only live by jumping from one human to the other. Each time it infects another person, it mutates a little bit. And that's true for all viruses. All viruses are constantly replicating. And every time they make a new copy of themselves, there are always at random some changes in the DNA of a virus every time it replicates. And it's those changes in the viral DNA every time it makes another copy of itself that we call mutations. And it's these mutations that can lead to a new variant, a new type of this virus. Now, some of these variants are not very good at surviving and they die off, and we never see them. Some of these variants have characteristics or properties that make them stronger than the original virus, so they can infect more people. And those are the variants that are of concern. And those are the ones like the Delta that we see spreading so rapidly because it emerged from these people getting infected over and over and over again, and it developed this new ability to infect people. And so it's more contagious than the original COVID.
Yes, and what you say for my audience is that the virus had the capacity to change, and when the virus pass from one person to another, they are more probability to have a mutation.
Right.
And some of those mutations can be good, but some of those mutations, the ones that are more strong, can be bad, like the Delta. No, we know that the Delta is more easy to spray because like 220 more effective to be contagious about Delta, and also is more lethal, no, particular. And this is because it's the way that the virus survive, no?
That's correct.
Okay.
Yeah, that's how it survives.
Yeah, and we know that there are many virus, there are many classifications of the virus, no? And we know that they are like alpha, beta, gamma, delta. Who named the virus and why they get those very fancy names?
Yeah, it's a good question. So we're always on the lookout for variants, and there are a lot of variants that we discover that we think are of no consequence. They're not dangerous. We're not worried about them. But when a variant starts to spread and we can say, oh, look, this variant is spreading from one person to another, then we designate it by one of the letters in the Greek alphabet. Alpha was the first COVID-19, and then beta was the one from the United Kingdom that emerged. And now we've got Delta, which emerged, we think, first emerged in India, is where the Delta came from. And we're already starting to see other viruses emerge that we're just keeping an eye on, like the Lambda variant as well. But we don't know enough about them yet to know how serious of a concern they should be.
Yes, and thank you for telling about the Lambda, because you see in this graphic that we had presenting for our audience, another thing is with the COVID-19 having many stereotyping, and we prefer to name the virus with the Greek alphabet because we don't want it to say the China virus or the Indian virus, no? But also, we don't want it to say the origin because then people taking in the wrong way.
That's
that
right.
is nothing to do because
That's right.
they can be originate also in India and in USA.
There could be a United States virus. Right?
Exactly.
The next serious virus could emerge here.
Exactly. In fact, we saw that the first virus, like you say, was alpha, and that coming from United Kingdom, the beta from South Africa, the gamma from Brazil, the delta from India. We have one, the epsilon from American, the zeta from Brazil, and multiple countries, the eta and theta for Philippines, and United States again, the lota, and the kappa from India. And now we have a llama because it's the next alphabet letter, and we are going maybe to go to C, no? But what I wanted to say with this for people that is out there, listen to us, the variant is nothing to do with the play because mutation occur in any part of the world when we have a disease, and this is a pandemic. And talking about the pandemic, I wanted to say that for a long time we have been pandemic, and the first pandemic we had, was in 165, and you can see that was the Antoniette play, and from then we have many play, and the play, you remember, in the 1980 was the HIV. It was a pandemic because of affecting all the country. We have a program talking only at the pandemic, and the pandemic now that we have is COVID-19. And through the first pandemic that we have the plague, the Japanese smallpox, the Black Death, the Great Plague, the 18th century plague, the cholera, and the yellow fever, and all of this plague. What I wanted to say is that when we have a pandemic, this repeating. Today is coronavirus, but we can have another thing. Can you tell me more why people that doesn't believe the vaccine is good shouldn't be vaccinated, particular in the window of all these variants? Why is it so important?
So we are in a race against time with the variants, and the race is whether or not we're going to get enough people vaccinated so we don't have as many variants emerging, or whether if we don't get everybody vaccinated or enough people vaccinated, the variants are going to win. There's eventually going to be a variant that overcomes the vaccine. Because right now, and this is probably the most important message I want people to hear, the vaccine that we have right now is effective against all the variants that we know about. So it's very important for people to realize the vaccine will prevent infection, but even if you do get infected, it'll prevent you from getting sick enough to end up in the hospital.
And that is very important. Listen what the doctor said. Dr. Parchman is a research investigator and also a family physician with many years of experience, not only in the area of the clinic, but in the research. And he telling that the vaccine is working, and they prevent against all these variants that we present. And this is very important because but we need to get vaccinated, because if we don't get vaccinated, there is going to be more variants. And those more variants can be more lethal than the one that we have. And this is what we need to know, And this is why we cannot stop and feel free about the COVID-19.
Yeah. So if you love your family, if you love your friends, if you love your community that you live in, and you love the people in the community that you live in, by getting vaccinated, you're preventing spreading the virus to them as well.
Exactly.
And you're preventing the development of these variants that we know eventually, if we don't win the battle, if we don't win the race, one of these variants is going to be, the vaccine will not be as effective for the current vaccine will not be as effective against a new variant. That doesn't mean we can't develop a new vaccine, but then we're starting all over again. Like we did at the very beginning of this pandemic. Then we have to come up with a whole new vaccine and go through everything that we've been through for the last year and a half all over again. And that's what we're trying to prevent by getting enough people vaccinated.
Thank you, doctor, for telling that. But listen, this is why we need to get vaccinated, because if we don't do that, we are going to have another variants that can be more that the actual vaccine that we have is ineffective, because this vaccine was created for the alpha. And so far, the alpha, the vaccine that we create, and all the vaccine, the Moderna, the Pfizer, the Johnson, are effective for the vaccine, the variant that we have. I wanted to
including
welcome,
the Delta.
Including the Delta. Yeah. I wanted to say hi from the Netherlands. We have Arkanti. And also, Kathleen have a question for you, Dr. Parchman, and we like to put it, and is, what do we know about Lambda and the vaccine right now?
So what we know about Lambda and the vaccine right now is that we have tested the effectiveness of the vaccine in the laboratory against the Lambda, and it appears to produce antibodies that will control the Lambda in the laboratory. There is emerging evidence now that in the community, people who are already vaccinated, we have a very few number of cases in the United States right now of Lambda, but the people who do get the Lambda, if you're vaccinated, they don't end up in the hospital. So we have very early evidence that suggests the vaccine is also effective and protects people against the Lambda. But we know very little about it because there are so few cases.
Okay. Thank you, doctor. This is a very good question. Again, my apology, I misspelling your name, but Arcanis from Netherlands, she say, or he said, sorry, that he had put the 2 Pfizer BioNTech shot, and I wanted to congratulate you because this is the best way that you, Peter, welcome, Peter. Thank you for being here with us. This is the best way, to be here, protecting and to love yourself and your family. I want also to welcome Adriana Velázquez. She always with us, and Jacqueline Ponce. Thank you, Jacqueline, for being here. Alina also have a question, and also Raquel. Raquel say, but if there is another dosage as a reforce, or we need another dosage, people that have taken the first and the second for the new variants, do you have some response regarding this question?
That's a really great question. And in fact, on Friday this week, the FDA, the Federal Drug Administration, will be meeting to discuss this question. I expect that we will know probably by early to mid-September whether or not it's recommended to get a booster dose. We don't know that yet. They're still reviewing the evidence. They're still reviewing the research to make sure that that the benefit of the shot is there, that there's enough evidence that it would be a benefit to people who get a booster. But I expect we'll know by sometime in September whether we should get a booster. We know probably what's going to happen is if it does get recommended, it'll first be recommended for people whose immune systems are weak. So if you're getting cancer treatments, or if you have a condition, a disease that makes your immune system weak, those are the people who would be recommended for the booster dose first. And then we'll see what happens with the general population after that.
Thank you, Dr. Parchman. The response is maybe, probably, and is almost yes, because almost the FDA is the Food and Drug Administration for people that is not from United States and is listening to us now, is they are meeting to decide who is going to need. But so far, they are talking that the people that will need a booster, to intensify the antibody response, because we see in the first video how the virus work, they overwhelm our antibodies, is getting a booster, and the more probably is that the people with the system immunocompromised, and this is people that have HIV and people that have cancer. No? What about people with chronic condition? I know you are an expert of chronic condition and diabetes. What do you say about people that have diabetes? Because in this country, a lot of Latinos have diabetes, and in our population, refugee and migrant, they are a lot of high. It's another pandemic. This is what we call, this is a syndemic, because people already have obesity or COVID-19 or diabetes, and now they are going COVID-19, and the interaction, all of them causing a lethal response, because we see that people with chronic condition are the people that are dying the most in the hospital. They are the one that need, a ventilator, and if you had obesity and diabetes or cancer or HIV, you are more probably to die.
That's true. And so there's several questions embedded in what you just said. One is about chronic disease. And yes, it is true that people with a chronic disease like diabetes, their immune system is slightly weaker in many cases because of the diabetes, and therefore they're more not only susceptible to get infected, but if they do get infected, their body doesn't fight the infection as well, and they're more likely to end up in the hospital. But I want to emphasize again that over 98% of people who are in the hospital today in this country with COVID-19 are people who have not been vaccinated. And over 99.99% of all the deaths from COVID-19 in the last several weeks are people who have not been vaccinated.
Wow.
So those are really important numbers to
Yeah.
remember. There was another question though embedded in your statement about protecting people from COVID. Oh, I know what I was going to say.
Yeah.
So another interesting point about this is I don't know if people know this, but every year I get a flu vaccination every year. Well, why do I get a flu vaccine once a year? Well, that's because the flu virus mutates every year. And we're able to monitor the virus. We have a worldwide monitoring system. People don't know this. We have a worldwide monitoring system that monitors the influenza virus, and we can predict which strain of the virus, which variant of the influenza virus is going to be the most prevalent one in our country this next fall and winter. And we design a vaccine specifically for that. So every fall, I get a vaccine for the flu. That is likely to also be the case with COVID-19, right? That as we monitor COVID-19, it's probably going to be with us, just like the influenza virus is, every year. And we're probably going to have to design a new vaccine every year, just like we design a new vaccine for the flu to prevent the COVID-19 infection in people, especially people who are older and people who have chronic diseases. Those are the people who need it most because they're the ones most likely to end up in the hospital.
Yeah, I wanted to make some comment because you have been talking about a lot of good points that I don't want it to lose, and I wanted our audience to really put attention. Listen the data, the statistic. 90% of the people that have now COVID-19 is people that have not been vaccinated. What is the meaning of that? If you are vaccinated, you have less probabilities to get the infection. And 99.9, listen, 99.9, this is the important people that is dying in intensive care now is the people that have refused to get the vaccine. And we have somebody for the Netherlands. And I know that we have other people from Italy and many other people because this is an international radio. Thank you to the internet. And I wanted to tell him that in America, unfortunately, has been very politicized. And the best, I am a public health practitioner, and the worst thing that you can do with a pandemic is politicize the pandemic. Because people have a statement not using masks, not clean their hands, and not put the vaccine. And getting all this misinformation and not getting. And this is why we are dying, why they are another country like India, Brazil, Nicaragua, when people is dying because they don't have the vaccine. And here people can choose what vaccine they can take. This is number one. The data doesn't lie. 99.9% of people dying in the United States now with more than 5,000 cases only in Washington, the state when this radio is located, is because they don't get the vaccine.
What's concerning is the number of cases is going up again like it did last fall and last winter. We're starting to see numbers in terms of the number of daily new cases, and that's because the Delta is more contagious than the original COVID-19. And people who are already vaccinated can also get the Delta. You can get infected with Delta. You could have mild symptoms like a cold, or you may have no symptoms at all. But even if you have no symptoms, you can still spread the virus to someone else. And that's another really important point I want to make right now and want people to remember is that even if you are vaccinated, you can get infected with the Delta variant of COVID-19 and give it to someone who is unvaccinated, and they will end up in the hospital. They may be, right? And I don't want to be that person to spread the Delta to someone who is not vaccinated for whatever reason it is that results in them ending up in the hospital. So that's why I am wearing a mask everywhere I go. I am putting the mask on when I go into the grocery store, when I go in to buy a coffee, when I go out. I always wear masks now because I don't want to be responsible for spreading the virus, even though I'm already vaccinated.
And thank you for let that know. Because this answered another question that many people, but we have a lot of people here that is asking questions. I wanted to give our audience time to answer those questions. And then the second question that we have, the third question is, what will happen to everyone under 12 years old?
Well, we are very close to being able to approve the vaccine for children under 12. They're still conducting the trial. They're still they have the data. They're analyzing the data now. And I expect within a month or I don't know when, sometime in late August, early September, we may see the same kind of authorization, the approval of the vaccine for children under 12. And of course, that's important as kids go back to school, right, in the fall. So we're still waiting on that approval as they analyze the data because, we want to make sure our kids are safe when we give them a vaccine.
Oh, wonderful. In Netherlands, thank you for telling and share all of that with us, Peter. People under 12, they will soon vaccinated. Wonderful.
Oh, wonderful news.
And this is very good that in American, people from 12 years up, they are going to get the vaccinated. And it's a myth that children didn't get the virus because Dr. Parchman have a meeting recently when people that working in intensive pediatric care are exhausting. Can you share, we have no name because confidentiality, but you can maybe telling us where are people, physicians like you and I, overwhelming because they are treating patients and children die also, and the intensive and urgent care is now in American with these children.
So I don't know whether people know this, but I live in Seattle, Washington, in the United States, and we have a children's hospital, the Seattle Children's Hospital here that specializes in the care of children. And a public announcement went out from the Seattle Children's Hospital last week saying that their beds were full of children with COVID-19. Their emergency rooms were getting full of children with COVID-19, and asking people like me, physicians like me, to not just send someone to Seattle Children's if they test positive for COVID, but to do a clinical assessment and see, do they really need to be seen in the emergency room? Are they really likely to end up needing to be in the hospital before I just automatically send them to Children's Hospital, because they are so overwhelmed right now and so overworked right now. And I can tell you that my friends who work in the hospitals here and in the emergency rooms here are already telling me that they are being asked to work extra shifts because of COVID-19, because the beds are starting to fill up again. And they're telling me that it's not like the last wave, which was largely older people. They're seeing younger people now in the hospitals with the Delta variant, and that's very concerning.
This is why I wanted to say that community health workers have 3 activities. We are going to get a bank with the vaccine, and we are going to be visiting you in Escagli, Grand County, with a high incident of COVID-19, and also in Giacomo, we are going to work with a lot of soccer team to invite everybody to get vaccinated. We are going also to use Uber. You can contacting us and using Uber and call 206-291-2599 to Jacqueline or Marta 240-551-891. Some people has problem with transportation. Okay, we are going to give the transportation to your children 12 years, and you can come in and your daddy and mom, and we pay for you too, because the most important is the children. And it is very sad to see some people see dying of COVID-19. I cannot believe how I will feel to see a baby. And if you are a parent, you are responsible for your children. And I know you love your children, and the last thing you wanted to happen is to your children die. And more worse, Dr. Parchman. You know what is the thing that really is for me, very sad? That the children can survive, and it's going to be sequel. Because we see many people that survive COVID-19 now, they are chronic patients. what are those sequelae that you had been see in people with COVID-19?
Yeah, so we don't know a lot about long-term COVID in children yet. We know in older adults or in middle-aged to older adults that you see people with extreme fatigue, making it even difficult to just get up off the couch. They're so tired. They have pain in their joints. They have chronic headaches. They have what we call brain fog, meaning it's really hard to think. It's
Mhm.
really hard to say, okay, first I'm going to do this and this and this, and I'll remember I'm going to do this. And the fog just prevents them from remembering why did I get off the couch? I've forgotten now. You don't remember things, which we think is an inflammatory reaction, a long-term inflammatory reaction going on in the body. It would be really sad for us to start seeing that in children too. You're right. I think we are starting to see some cases of like that in children, but we're still collecting cases to be able to define this and to say, is this the same in children as what we're seeing in adults? It probably is, but we're still collecting information to confirm it. But yeah, it would be sad.
Yes, and this is very sad because COVID-19 present in different way, and it's a multi-systemic condition because that it's true that go more to our respiratory system, but they go to all because it's the endothelium. We see how they cause pneumonia, but at the same thing that they cause pneumonia, it's like he low the more weak part of our body. If you have diabetes, they love to go to the kidneys because there are many people that are surviving with diabetes and now they need a kidney transplant or they are using, the one of the kidney function is that. I have another friend. I have two cases of people with COVID-19 that now they have a glaucoma, or they have a hemorrhagic, in the retina. And this is also something that they need to take care because they can lose that.
Mhm.
I have cases when people are calling me and tell that some men has lost the virility, meaning they're giving impotence. Okay, whatever it is a lot of things that we don't know about COVID-19. We don't know it is related maybe some cancer because we know virus. Some of the virus are related to some cancer. HIV, for example, they're giving a Kaposi cancer, sarcoma, and we know that the papillomavirus is associated, with the cancer in the women, uterine cancer. And we don't know, and we know, that there are other viruses, and this is what concerns me, that what COVID-19 virus, what cancer is going to be related in the future, because this is going to be a long thing to see, no?
Yes, I want to go back and make one more point about children
Yes.
under 12. Since they are not eligible for the vaccine, it's not authorized to use in children under 12. That means that those children depend on us getting vaccinated to protect them. That if enough of the adults will get vaccinated, the virus spread will slow down enough that our children will not be exposed and will not get infected. So children depend on us to protect them by getting vaccinated right now.
Thank you for mentioning that because this is another good reason to using mask, to keeping distance, and getting hand sanitizer for those people. And I wanted to talk about Peter comment about say what worried me when I look at the USA is seem to politicize the issue and less health. And it is true. Unfortunately, as a public health practitioner, I can tell you, see, it's not only politicized, but also monetized. Okay? People have choose between human and business. We open the business, you can come inside and don't use the mask. And you know where you are going to be contaminated with all these variant mutated is inside. And another thing is, yes, you take, I wanted to say, because you have a liberty as a human. And this is maybe philosophical, Dr. Parchman, but as a public health practitioner, I say, I don't think in one individual. I see in the community. And the right of you as individual need to be overwhelmed for the right of the community.
Mm-hmm.
For example, why you believe there are areas when people cannot smoke? Because smoke causes cancer. And there were a lot of studies. And at the same time, we have a lot of problem with the industries that promote smoking. Be nice, be beautiful. Beautiful women smoking, oh, you are cute, you are cool. And many years in that fight with the business. Until now, we have places when it's smoking and no smoking. Why is that? Because the smoke causes cancer, and not everybody develop cancer because of smoking, because you have to have a predisposition to have that cancer from lung cancer. But they prove this is the same like now. People say, oh, you take my liberty. But when you liberty, put in risk and kill, because for me, you are a bone.
Mm-hmm.
For me, you are maybe a killer. If you don't have the vaccine and you have the virus and you go out, knowing that you have the virus, spray and touching everything and talking with people. Because for one person that has the COVID-19, he had the capacity to transmit 10 times to the alpha virus. The delta, I don't know. Must be 10,000 multiplied for 220. That is the capacity of infection. But, it's politicized because my right not to use mask is protecting. I can get the virus because we don't know who get it and who doesn't get the vaccine. I can say I get the virus, the vaccine, and I am not vaccinated. And this is why our has been increased, no? Why is that, Dr. Parchman?
So this is something that, if you look at history, humans have been debating this issue since the time of the Greeks and the Romans about where does your freedom end and where do my freedoms start, right? This debated in classes in ethics, in classes in philosophy, and in general, what most societies end up deciding is that your freedoms end where my I am put at risk or I am put at danger because of your freedoms. So if your freedoms cause me to be at risk or in danger, then no. As a society, we're going to agree that you do not have the right to do that. And let me give you an example of that. We have decided, it took a long time, a number of years, we have decided that you should not drink and drive. You cannot be drunk and drive a car. And there are strict laws and enforcement of those laws. It took us many years to debate that and to come to that decision and to develop those laws. And now it's a norm. It's everybody agrees you don't drink and drive, right? We're having the same kind of debate about vaccines right now. It's a similar kind of issue, which is, and I empathize with people who are afraid of the vaccine. They have real fears. I am not ignoring their fears. Their fears are real, and their concerns are real. And I validate the fact that they have concerns and fears about the vaccine. And it's okay to have concerns and fears about the vaccine. But I think a more important way to, as a society, help with the vaccination rates is for us to have these honest conversations with our friends, with our families about why are you afraid? What is it about the vaccine you're afraid about? And let's talk. And let's talk about your fear and and empathize with them, right? And I think that's a better way for us to get more people vaccinated than to try to make them feel guilty or to try to scapegoat them or to try to, be angry at them. I think if we show more empathy and have more open conversations with our friends and neighbors, we'll make more progress.
Yeah, I believe that first is no knowledge. And I believe that unfortunately there are a lot of misinformation around, especially in America.
Mm-hmm.
Thank you, Peter, for joining us. He's late and he's going to leave, but thank you. I will say that this is why the coalition, we have a lot of workshops because we wanted to give in the fact to people and they take the decision. We respect everybody's opinion, but we don't want it to see any more dying. I cry because I say that can be prevented. And
Yes.
any life, every life is
It's
important.
precious.
It's precious. This is why, organization like us, as working with that, it's not like many people say, that somebody calls somebody else, and say, oh, the vaccine is killing, when it's the opposite, the vaccine is preventing, and the data doesn't lie,
Mhm.
Unvaccinated people are the people that is in the hospital now.
Yeah. And so I think we need to practice our what we call our scripts, right? It's like a script for a movie or a script for a TV show, right? And saying, "Oh, where did you get that information from? Where did that information come from? Where you believe that the vaccine is killing people." And have that open and honest conversation with him about what's the source of the information and do you trust it, and why do you believe it, and what are your concerns, and what have been your past experiences with vaccines, and talk.
Exactly. We are going to have some commercial now, but we are going to coming back with more questions from Maria Choquerunta. And I believe I see Raquel Yepes and Kathleen. But now we wanted to telling you that you can listen Los Originales in Amazon. You only need to see Alexa, play Los Originales, Community Health Worker, Radio, and you will listen that. And remember, we have the Ubers if you wanted to take the vaccine. And now we are going to telling you that we have a organizing a survivor a survivor party for everybody that work in the community health worker, and we are going to have typical dresses, and we are setting donation for transportation and hotel for our community health workers. And most important, I wanted to share the following with you. Hola mi gente linda, esta es la doctora Ileana Ponce-Gonzalez, la directora ejecutiva del Community Health Worker Coalition for Migrant and Refugee, y los invito a que me escuchen todos los lunes de 1:30 a las 2:30 desde Los Originales CHW Radio, la única emisora en español desde la ciudad de Edmond, Washington, las 24 horas del día, los 7 días de la semana. Hablaremos de todos esos temas importantes de salud que afectan nuestra comunidad, especialmente para todos ustedes los community health workers. No se la pierdan, nos esperamos. Gracias. Well, we are here again with Dr. Parchman, and we are going to ask the other question that we have. What we know, I believe you already responded, no? What we know about Lambda and the vaccine right now?
Well, the vaccines we have, the Pfizer, the Moderna, the Johnson & Johnson, are all effective against the Lambda, the Delta, all the variants we know about.
Okay, and Maria Choquerunta have a very good question. She says, if somebody has taken the Pfizer, the first dose, can that person take Moderna or vice versa?
It hasn't been officially authorized or approved, but we know that there are cases where the Pfizer dose is not available and the Moderna dose is, and the data show that those people get the same benefit. And there's no risk from taking one or the other. Both the Pfizer and the Moderna are the same type of vaccine. So if you take one the first time and the second one is a different vaccine, the Moderna, say the Pfizer or the Moderna, then yes, I would go ahead and recommend they get the second dose.
In addition to what you said, Dr. Parchman, I have a lot of physician friends, not in USA, but in Latin America as well as Europe. And we're talking a lot about COVID-19. They don't have the privilege the Americans have to have the same doses. And what they're doing in their country is taking whatever you have.
That's right.
And they have been taking different kind, for example, Pfizer and Johnson. And when they have the Johnson, they take the Pfizer reboost, because the effectiveness of Johnson is like 67 and the Pfizer is 94. And what they're doing in Latin America is taking whatever you get. And so far it's effective, that they get it. There is no study, but they don't get infectious as the other people that had not been vaccinated.
True.
And also people in Latin America, they want the more they get it, the Johnson, and then those people are waiting for the second doses, whatever vaccine is. And I wanted to tell you that this is what they have. Let me see, do we have another question? Well, we don't have this person. Okay. Talking more about the variants. Raquel Yepes, she have a question. Let me see. I read her before. Yeah, I believe you have. If we are going to need to have a booster after the 2 doses, like if you complete your 2 doses of Moderna, or then if we complete the 2 doses of Pfizer, or if you get only one for Johnson & Johnson and American, do we need a third doses?
We will all probably eventually need booster doses, yes. And in fact, they are working right now on a newer vaccine for COVID-19 that has more coverage, more effectiveness against these newer variants. And that is likely to be the booster dose that we all need sometime in the next year. So we'll see what happens.
What are you telling us about COVID-19 at the rate? We have almost 2 years now dealing with the COVID-19. Do you believe this disease is going to stay with us like influence? Or we are maybe, I know nobody had the answer. I'm sorry I asking that, but I am curious to know. What do you think? If we are going to live with her as we're living with the influenza?
Well, it's important to remember that we have always lived with the coronavirus. The coronavirus has caused the common cold or the gripe for decades and decades and decades. So the coronavirus has always been with us. It's always been circulating in our community. What's different is that this one is novel. This one is so different than the original coronavirus that our bodies have no immune response to it. We have no natural immunity to it like we did to the older versions of the coronavirus. So yes, the coronavirus is always going to be with us. It always has been. And the question is, how will we adapt as a society to suppressing it, to controlling the spread of it, so that we all develop enough what's called herd immunity, that it doesn't keep spreading? Let me give you an example. We don't worry a lot about measles in the United States because we have close to 90% of the population vaccinated against measles. So measles can't spread in the United States. We don't worry about it because we have enough people vaccinated that we don't worry about it. And that's where we want to be with the COVID-19, the COVID vaccination eventually.
It's true. Thank you. This is really important information, everybody get vaccinated. Another thing that many people ask me, what is more important, the vaccine or the prevention?
Well, the two go hand in hand. You can't do one without the other. Right now, we know that the vaccine is effective, but we also know that people with the vaccine can continue to spread the virus if they are infected. So that's why the masks are important. It's so important right now that we all wear masks, because I could be infected with no symptoms at all, walk into a place of business, a restaurant, a store, whatever, and spread it to 2 or 3 other people in that store. And that's why I wear a mask, because I don't want to be the one responsible for spreading and social distance, right? The 6 feet.
I wanted to thank you for that because, I believe this is one of the problems that we have in America, that is a curative medicine rather than preventive.
That's right.
And actually, I believe one of the struggles that have this country is with prevention. We don't prevent anything because we have been in most of the case cleaning, and they are a lot of therapy, for maybe not everybody, but some people. And prevention, there are not many people working in prevention at all, like they always curative. You go to the doctor when you are sick. You have diabetes, you go to the doctor. And this is why we have a epidemic, because we can go when we have pre-diabetes or when we have obesity and start there. And this is the problem I see, is when virologists say, vaccine is the only thing that cure, because there is what they wanted, vaccine, but it's not really vaccine, because if we have a vaccine, then we have a virus that mutate, and this is why we have lost the fight against the viruses. I believe if they are a atomic bomb, we die first and the virus after, because he will killing us first, and he will kill him because he will die, we die, but he will die after us, not before, because we don't have, like bacteria, antibiotic to cover there. And then many people say, okay, vaccinated people, they believe because you are vaccinated, you don't get it, and you can go and then use it. But and really is because we are vaccinated, we can get another variant, and we can maybe not have any symptom, and we will spray the virus. All the people that have not been vaccinated, that can be your neighbor, can be your grandma, or can be somebody that you love, or either people that you love because you love people, and both need to be equally important. Okay, vaccination, keeping distance, using masks when you have more than 3 people, and clean your hand. Especially now that have been increasing 3 times compared with the last month, the cases of COVID-19 in all the states. I am wrong, or I misunderstood the information I received?
I think you're mostly correct about that. I think another important point to remember that you reminded me of just now is that people sometimes say, well, it's just another cold virus, and if I get really sick, I can go to the doctor and get medicine for it. And that is not true. There is no medicine for COVID. There's no antibiotic. Antibiotics do not work against viruses. So there is no cure for COVID-19. There is no way to kill the virus with medicines that we know of once you're infected. And that's why there are some people, we see them in the emergency room, we see them in the hospital, that we support their breathing, hoping that their body will recover naturally on its own, because we have no proven. Now, there are a lot of trials going on right now, tests of what we call antiviral medications, to see if any of them will fight this virus effectively. And you may have heard about some of those that are injections and those kinds of things for a virus. And those are still available, yes, but they don't work 100% of the time, which is why it's so important that we prevent people from ending up in the hospital.
Thank you, Dr. Parchman. This is very, very true. And to give an example, is HIV. The therapy that the people use is not cure the HIV. What they do is to bring the level or low of viral down that is not infectious. But when you get HIV, you have it for all your life. It's going to be your company. And COVID-19, when you get it, you have the disease, and there is no any treatment for that. What you get is palliative medication. Like, for example, you cannot breathe, then you're giving a ventilation and waiting for your immune system to be strong enough to survive the disease. And this is why I wanted everybody to know and it's not only other call. I wanted to close with something very important because I spoke with you before about that, and it's about the people that is dying. We wanted to pray for them. We wanted to pray for everybody that doesn't believe in vaccine, and unfortunately, they believe the lies of the people around. We love you. We don't want you to die. We may be thinking different, but we know that the data is the data, and we wanted you to get vaccinated. But if you don't want, we respect you. But I wanted to share some history about people that is dying now in intensive care and what they say now that they want the vaccine and what is the response of the physician. Can you share with us some of the history you shared with me before?
Well, there are several examples where my colleagues have said that they've had patients who are in the ICU and who are not doing well, and several of them eventually do die from this. Who say to the physician, first of all, they come in, they say, "Can I go ahead and get the vaccine?" Well, no, it's too late at that point to get the vaccine. It will do no good. It won't help. Secondly, they say, "I wish I had the vaccine. I wish I had gotten the vaccine. Please tell my family to get the vaccine." And these are people who are dying in the ICU. Yes.
And for this, all our praying for them and the family that have a patient or a loved one in intensive care right now, we are with you. It's too late when you are in intensive care. It's no vaccine that can prevent you. This is why we invited you to visiting us in Thurston, in Giacomo, in Grants, and Sky, where we are going to be in the couple of days with our vaccine campaign, and going wherever you go and get it, the one that you have. Our caravan of health will be visit Thurston, Grand County, and Sky. And also, I wanted to thank you, Dr. Parchman, because I know you are very busy, and I know you are on vacation because you are in vacation. Hola mi gente linda, esta es la doctora Ileana Ponce-Gonzalez, la directora ejecutiva del Community Health Worker Coalition for Migrant and Refugee, y los invito a que me escuchen todos los lunes de 1:30 a las 2:30 desde los originales CHW Radio, la única